Welcome to another presentation by My Weight World. This presentation is titled Women and Obesity. This presentation is designed to give you a brief overview on the topic of women and obesity. Introduction. Weight plays a critical role with many women, affecting their health negatively and shortening their lives. Weight gain as a trend has worsened with all populations, including women. Unless something is done to reverse this trend, more and more women will die prematurely and their quality of life will continue to decline. Let's look at some statistics from the United States. Over 50% of women are overweight. Over 33% of women are obese. These numbers are incredible. This table looks at trends in weight increase in women. Let's look at the middle column between 1988 and 1994 in percent. The right column is the percentages between 1999 and 2000. The percentage of women who were overweight in 1988 to 1994 was 51%. The percentage of women who were obese was 26%, and the percent of severely obese women during this time was 4%. Now, turn your attention to the right column. We see a general increase in all categories over the past decade. Between 1999 and 2000, 62% of women were overweight, 34% were obese, and 6% were severely obese. Again, the trend is getting worse when it comes to women having weight problems. Socioeconomic status of women. Obesity worsens as income goes down. The poor are affected by obesity more than the middle or upper class. As a result, minority populations have a higher level of obesity. Age and overweight. As we see from the table, as women age, they are more likely to become overweight. These statistics were taken between 1999 and 2000. Age and obesity. As women age, they are more likely to become obese. Remember, obesity is worse than just being overweight. These statistics were taken between 1999 and 2000. During this time, 23% of women 20 to 29 were obese. 33% of women between 30 and 39 were obese. 35% of women 40 to 49 were obese. 41% of women 50 to 59 were obese, and 43% of women 60 to 69 were obese. Race and weight. Within the U.S., African American women have the highest rate of weight problems of all major races. White Caucasian women have the lowest. Still, whether you are an African American, Mexican American, or Caucasian woman, these numbers are astronomical. Specifically looking at African American women, 78% are overweight or greater, and 51% are obese and greater. Dying. For those women who are obese, a BMI greater or equal to 30, the risk of death is 50% higher than the non-obese population. Comorbidities. Comorbidities are medical problems related to increasing weight. Women have some problems due to their weight similar to men, as well as unique issues that men don't face with weight. We will now examine some of these comorbidities. Comorbidities. Arthritis. Obese women have a 4 times greater risk of arthritis than non-obese women. There is a stronger association with arthritis in obese women than men with similar weight problems. Comorbidities. Birth defects. Maternal obesity, obesity during pregnancy with a BMI greater or equal to 29, was found to be associated with a higher incidence of certain birth defects, specifically neural tube defects, which are covering of the nerve system, for example, spinal bifida. In summary, obese women give birth to more babies with birth defects. Comorbidities. breast cancer. Obese women have an increased rate of breast cancer after menopause. In addition, increased rate of a very lethal form of breast cancer called inflammatory breast cancer, and a shorter lifespan with breast cancer with weight problems than those without a weight problem. Comorbidities: endometrial cancer. Obesity is associated with causing a 3 to 4 times greater risk of endometrial cancer. Having diabetes and being obese causes an increase even higher than this. 34 to 56% of endometrial cancer attributed to being overweight. Overall, endometrial cancer is seen at a higher rate with women who have a weight problem. Comorbidities: heart disease. Increased risk of heart disease, especially in middle-aged and older obese women. Comorbidities: gallbladder disease. Obese women have a 2 times greater risk of gallbladder disease as compared to normal weight women. Comorbidities: infertility. Obesity adversely affects ovulation, fertility treatments, pregnancy rates, and pregnancy outcome. In addition, obese women who lose weight before pregnancy have a higher chance of becoming pregnant and carrying the fetus to full term. Overall, weight problems negatively affect the chances of becoming pregnant. Comorbidities: menstrual abnormalities. Obese women have a higher rate of menstrual abnormalities, 3 times higher than those without a weight problem. Comorbidities: pregnancy issues. Obese women have a higher rate of miscarriage as well as problems during pregnancy, including high blood pressure, diabetes, urinary infection, a higher chance of C-section versus vaginal delivery, a higher chance of overdue births and longer labor, and a higher chance of blood loss. Comorbidities: after pregnancy issues. After delivery, obese women have a higher rate of C-section incision infection, endometrial infection, endometritis, which is also an infection, along with urinary tract infections. Comorbidities: urinary stress incontinence. Obese women have a much higher incidence of urinary leakage due to their weight compared to women without a weight problem. Comorbidity: social issues. Obese women have a perceived higher rate of prejudice and discrimination against them. There is a higher rate of unemployment than those without a weight problem. They have worse social relationships and attend fewer years of college and receive less financial support for higher education than a woman without a weight problem. Summary: weight problems in women are on the rise, and they are serious. African American women are affected more so than Hispanic or Caucasian. However, Hispanic and Caucasian women also have a very high rate of obesity. Rate of dying is higher than non-obese. Comorbidities are high in women who are overweight or obese, and many of these problems are unique to women. Overall, these problems will only get worse as women get heavier. This has been another presentation by My Weight World.